A common area of medical negligence is a failure to diagnose a heart attack or myocardial infarction. So myocardial infarction is when the heart does not get an adequate blood supply that's supplied by the coronary arteries. And when there's a blockage there, the blood doesn't flow to that portion of the heart, and as a result, the heart muscle begins to die, and they have to restore that blood flow. And the sooner that's done, the more likely, the more probable that heart tissue can be saved. And so when you go to a doctor, they may interpret those signs and symptoms of what seems like a heart attack as something other than heart attack. So, for example, they may interpret it as something as gastrointestinal upset. They may fail to do an EKG, and the EKG may seem normal because there hasn't been enough time for changes to occur in the electrocardiogram. They may choose not to do what's called cardiac enzymes to see if there's been damage or there's some sort of damage occurring in the heart muscle or the muscles of your body. And so that's another way that they can detect it. Now, there are all kinds of reasons why doctors may or may not miss it. So I'll give you an example of a case that I had where a woman who was a young woman in her 30s was rushed to the hospital with chest pain. She was taken there by ambulance, and the doctor worked her up, and he sees the EKG shows what it looks like a heart attack. Now, he says to himself, well, this is a 30-some-year-old woman. 30-some-year-old women don't have heart attacks. So he looks at this EKG and he thinks, well, you know, it looks like a heart attack, but it's really probably pericarditis, an inflammation of the lining around the heart. And so he misinterprets the EKG because he gets fooled by her age. And as a result, he discharges her, sends her home. She winds up dying of a heart attack a few hours later. A very, very tragic case. He got fooled by her age. Instead of believing what that EKG said, he should have worked her up. He would have taken her to the cath lab. He would have repaired the cardiologist would have repaired that coronary artery, and she'd be alive today. Tragically, she left, you know, a loving family and died way too soon. So, you know, that's something that's critical. If you have a loved one it seems like they're having a heart attack, make sure the doctor does all the tests that are available to them to rule out heart attack, the EKG, the cardiac enzymes, you know, and consult with a cardiologist. Ask to see a cardiologist when you're in the emergency room.